The LeapFrog Group was created to shine a light on patient safety in healthcare, with the hope of reducing the number of preventable medical errors made in hospitals and healthcare facilities nationwide. Twice a year, they break down public and provided data from more than 2,600 hospitals around the United States, giving each a consumer-friendly letter grade following the evaluation. Before we break down the grades for each hospital, let's talk patient safety. LeapFrog defines patient safety as how hospitals and other healthcare organizations protect their patients from errors, injuries, accidents, and infections. According to LeapFrog, as many as 44,000 people die every year from preventable hospital errors. 1 out of every 25 patients will develop an infection that didn't have to happen. And Medicare patients, they have a 1 in 4 chance of experiencing injury, harm, or even death. LeapFrog's hospital safety grades look at 28 separate safety measures that are given a ranking from below to above average. Those measures are then put into 5 categories: infections, problems with surgery, practices and preventable errors, safety problems, and doctors, nurses, and hospital staff. Looking at the infection category, neither MercyOne nor St. Luke's stand out, but they also aren't among the worst. According to the data, you are more likely to get a blood infection at St. Luke's, but at MercyOne, you're more likely to see a surgical site infection. Now, while both hospitals are below average in these measures, they aren't alarmingly so. Now, speaking of surgery, both MercyOne and St. Luke's are rated among the best when it comes to not leaving an object in a patient's body cavity. But St. Luke's did receive a low score regarding patients developing a serious breathing problem during or post-surgery. If we look at the physicians themselves working to prevent medical errors, both MercyOne and St. Luke's are about average. But when it comes to staff at each hospital working to prevent those errors, both MercyOne and St. Luke's are ranked among the best in the nation. Patient safety while under the care of hospital staff gets its own category. St. Luke's tops the list here twice, especially for tracking and reducing the risk to patients. The final category is given solely to a hospital's doctors, nurses, and staff. It's here where both Mercy and St. Luke's receive high marks in the matter of having enough qualified nurses on staff. St. Luke's also tops the list for hospital leadership making patient safety a priority. With all of this data, you might be wondering, how can I use this information to make sure I'm getting the best healthcare possible? The best thing you can do is ask questions.
We're asking patients and consumers to get more involved, asking questions, maybe seeking second opinion, and maybe taking an advocate with them when they go for care. That way they're more proactive. By asking questions, I think it's a long ways toward getting improvement.
Overall, Peach says hospitals in Iowa do provide really good care, but there is always room for improvement.
The individuals in medical care people are dedicated people and are caring people, doing the best they can, but humans make mistakes. So the process they use, the methods they use, is where the improvement needs to occur.